Thank you very much, Mike.
Good to see you. I mean, it's all been rather overshadowed, hasn't it, what Starmer wanted to say yesterday? But I've been sort of slightly tongue-in-cheek suggesting that he seems to be wanting to privatise it. And surely if the Tories had done that, he'd have been all over them like a rash. But he seems to be embracing the privatisation of some parts of it. And I'm not sure that anything that he said yesterday is particularly new, is it?
No, I'm afraid, you know, 1 million new appointments, great, but who's going to do them? I mean, there's no more staff. You can't, locum agencies, people that hire, agencies that hire temporary doctors, are crying. I get approached once a day with them as, can I go to Wakefield and do an oncology locum, for example? I mean, you know, it's just understaffed. The private sector can do efficient things and it can innovate in a way the public sector struggles. You know, NHS committees are the most time-wasting, boring place to go. If you really want to go to sleep, you go and sit on a trust board. I can tell you, it's just loud mouths talking a load of rubbish, and it's no way any industry could run. And the politicians couldn't run a business. So I think that's our problem. We've got to. The NHS is in trouble. Streeting says it's in trouble. So at least the admission's there. They're calling out for reform, but no one knows what the reform actually looks like. Yesterday was the first attempt to show that to people.
Well, one of the things that he made a big deal about was this NHS app, which, of course, first kind of emerged during COVID, where they wanted everybody to do everything on an app. Now, one, that's not practical for an awful lot of people, particularly elderly people who don't know how to use apps and wouldn't really know what to do with one if they had one. Similarly, I mean, if you suddenly go tick, tick, tick on an app and you go, right, I've made an appointment for something, that's all very well, but it has to be somebody who can actually see you. So unless you're providing more people to see people, the app doesn't make any difference, does it?
Well, I think using, you know, everyone's got these. I mean, the next generation of old people, namely me, really old people, will know how to use the phone, a smartphone.
Yeah.
And, you know, it's amazing. To book an airline ticket, a cheap ticket, you have to be able to use a phone. You have to be, and as we've heard, one of the budget airlines is going to introduce, you can't have a paper boarding pass, you've got to have it on your phone. So that's the way the world is going. And the NHS should embrace that. All I can get from the NHS on this is the numbers of my vaccines for COVID. I can't get anything else. I can get prescription on it and I can go to a pharmacist with it, but I can't get an appointment. I can't book a scan. I can't do anything. That's going to change. And that is sensible. Can it be done? The app is a private sector device. It wasn't made by NHSX, which is the IT division of NHS. The phone's obviously private sector. Why not have private CT scanners that go and do it? It would be much more efficient.
Well, this is the thing. I mean, I say this, I said it to Stephen Dorrell yesterday when he was on, you know, I know people who have gone privately to get things like that done, and it seems to be absolutely so smooth as clockwork that you can go from, you know, getting an appointment to see a doctor, to getting a referral, to getting a scan done, and to get the results of the scan, all within, you know, a week or 10 days. I don't see why the NHS can't do that.
I know. There are Go Compare sites on Google where you can, if you want to say, my son had a bad knee, he's a marathon runner, he wanted an MRI of his knee, you know, it would take 6 months on the NHS. You go on the Go Compare site, 300 quid, 8 o'clock in the evening, somewhere in Waterloo, fantastic service. Result the next day, scan given to him as a disc so he could go to an orthopedic surgeon and ask for an opinion. And that's the way forward. And people don't mind travelling and they don't mind doing things at unusual hours, 10 o'clock at night, if it's cheaper or it's quicker. And that's what people want. They want quick service. You go into hospitals and you just look at the waiting room, and the one thing you notice is they're all old. Everybody is old, and that's clogging the whole system. It's not been planned for the age distribution we've got in this country. That's where we need to have a revolution.
No, quite. And what do you make of this other suggestion that if people are obese or they're smokers, they'll be sort of shoved to the back of the queue until they take some kind of control over their own body? Basically, people who are obese will be told they'll only be given a date for an operation if they've been assessed as fit to proceed.
I think that's a dangerous way forward, Mike.
I think so.
A shaming, a fat shaming, smoking shaming.
Yeah.
I think treat people equally. You know, there was a fuss at the beginning of at the end of last week about migrants being given priority in the emergency room to come forward. I think any sort of prioritization or anything holding people back for any reason is probably not the correct way. It's also quite difficult to enforce, and it's unpleasant to enforce. And I think healthcare's got to be a pleasant environment. It's exactly like at an airport. The airline staff are pleasant. The security staff can be a bit grumpy.
Right.
And they're careful. There's a boundary between the two. So I think you'd have the same in healthcare if you tried to enforce that sort of thing.
Yes, I think so. Professor Karol Sikora, great to talk to you. Sorry